Hi, I'm Dr. Olmos, and I'd like to welcome you to our weekly video series, Ask Dr. Olmos. The question for today is from Teresa. My 12-year-old daughter, Allie, was diagnosed with enlarged tonsillitis by Dr. Weeks. Can you explain the tonsil shrinkage procedure and what age is appropriate? Well, tonsils are basically our lymphatic system, immune system. And so they swell in the exposed areas like the throat and adenoids in the back of your nose. So nasal passages. And so usually that's from aberrant breathing. So if there is nasal pathology and the person has to mouth breathe, then it irritates those tissues and they enlarge. So they're really the symptom of the problem, not the problem themselves. But in getting big, they can block the airway. And that's where therapy needs to come in. Because if they're so enlarged that now they threaten to produce a problem of affected airway, like obstructive sleep apnea or something, problem like that, or just a problem in being able to swallow, so choking and this sort of thing becomes an issue, then treatment needs to be initiated. So that would be tonsillectomy, which is or reduction of the tonsils. Tonsils normally, so the greatest amount of swelling and lymphatic tissue is at age 10, and tonsils normally just start to shrink after that point. So if we see tonsils still swollen past that point, then this is obviously a sign of improper breathing. So the standard techniques are to reduce the tonsils, sometimes remove them, and the adenoids if necessary. And this is one of the first line treatments for children with obstructive sleep apnea. And those symptoms are restless sleep, loud noises, snoring, kind of whimpering kind of sounds, wetting the bed, fatigue, and cognitive memory losses, ADHD type symptoms, and this sort of thing. So if in combination, then a sleep study would be indicated. What is being done right now using special laser systems are being tested at the University of Manitoba. There's a study going on so that these tonsillar tissue can be shrunk rather than removed, which is a much more less invasive procedure. And hopefully through that study, they will have FDA approval. We have that kind of laser in our facility here in San Diego, and we use it to treat people with snoring problems by shrinking the tissue that blocks the airway. So in the future, that might be a treatment for tonsils specifically. Make sure you subscribe to our channel and submit your questions for next week's video.